Thank you in your home.
Ladies and gentlemen, here it is.
Streaming 24/7.
24/7.
Bold Moves Radio.
Bold Moves Radio.
Afrika nakupenda sana. Oh, Afrika nakupenda sana.
You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I am Rhulani Baloyi. I am your host. Thank you for joining us this afternoon. As always, I'm not by myself. I have a wonderful woman with me, Dr. Tshegofatso Sekhaolelo. She's our gynecologist. Some of you who have been here before, you may have been with her in one of the conversations that we had talking about health that pertains to women. And this afternoon, we are grateful because it's the month of May, a month which has been dedicated to celebrating mothers. And we felt as Bold Moves Radio and Prudent Woman that we should take a moment and focus on this wonderful person, the mother, because a mother is someone who always look after the health of their family members, and they tend to forget about themselves. This afternoon, we want to zoom into the mother's health. That's why our topic this afternoon is the mother's health. Thank you to all of you who are joining us. And you know, as Prudent Woman, we say we spark conversations. Of course, this 1 hour may not be enough, but we wish for you to be part of this conversation. Let us have this conversation and talk to our gynecologist, who will be taking us through a number of health issues that pertains to mothers. And of course, we may not exhaust all of them. So the few that we will touch on, but I believe as a prudent woman, because we are women who always say we want to be ready in and out of season by having information so that we can respond up accurately for the benefit of ourselves, our loved ones, and those who are around us as prudent women. You are welcome. If you are listening to us via the Bold Moves Radio social media pages, you are welcome to join this conversation. If you are on YouTube, please drop down your comments, your questions on the comments section. If you are listening to us via the streaming of Bold Moves Radio, you are welcome to be part of this conversation. You can send your questions, your comments on 081 358 8745. The number is 081 358 8745. You can send through your questions, your comments via WhatsApp. We would like you to be part of this conversation. Dr. Tshegofatso, welcome to Bold Moves Radio. Yes, you are a regular here, and we appreciate the time that you take to come and educate us as a woman, to make us prudent women, of course, by having the knowledge and the know-how on how to go about issues of life. Even as we say, happy Women Mothers Month, because last week was the actual day when we're celebrating mothers on a Sunday, but we believe it's our month for the whole year. Welcome to Bold Moves Radio. Dr. Tshegofatso, for the benefit of those who are listening to you for the first time, who has never had an opportunity to be part of this conversation when we were having you in Bold Moves Radio, I'd like you to introduce yourself, let the people know who is Dr. Tshegofatso.
Okay. Thank you so much, Ma'am Rhulani. It's always a great pleasure being on Bold Moves Radio on Prudent Women. Through this program, I've also become a prudent woman. I am Dr. Tshegofatso Sekhaolelo. I'm an obstetrician and gynecologist. I have a private practice called Gynified. I also work for the government because I really want to take care of all women as much as possible. I'm also a senior lecturer at the University of Limpopo, which I'm trying to groom future doctors, to be able to prioritize women and take care of them. So that is me.
Thank you very much, Dr. Chiho. I believe those who are listening to us now know who is our guest this afternoon. And you are also our guest, all of you who are listening to us, because we're going to be part of this conversation. As I indicated when I opened the session, to say today we're going to be talking about a mother's health. Mothers are very important. You know, they say you cannot give that which you do not have. So if we do not take care of ourselves, how can we be able to take care of our loved ones? And I always say a woman is like a factory, you know. You give us something, we give you the best out of that which you have given us. So it's very important for us, mothers, to take care of ourselves. Dr. Chihu, as a gynecologist, someone who takes care of women's health, what will you say about the importance of health pertaining to mothers?
Okay. So the health of the mother, Mam Rhulani, is actually not just important for the woman alone. It's important for the families. It's important for our communities. It's important for our societies. I'll tell you why. Firstly, a well woman will be able to take care of everyone around here, the children, the husbands. Sometimes they even have to take care of the elders. But well, you will not be able to. If I know you, you're likely to also even prepare food or life, in terms of like sleeping patterns or sleeping hygiene, in terms of the hygiene. It is the mother who will tell you, hey, you are missing a toothbrush. You need to get another one, or they go get you one. So that's important. So imagine if the mother is the one who gets the toothbrush or notices that you haven't brushed your teeth, they get a toothbrush for you. So that next person, that child, or the husband or the other family member now becomes hygienic when it comes to maybe dental hygiene. The other thing is also important for the society. If a mother is not well, let's say is not well emotionally, here you are shouting at your children emotionally, abusing them, bringing down their self-esteem. What will happen to that child when they go out to the society? They have low self-esteem. They can end up becoming bullies and whatnot. So we are breeding a society of bullies. And also, when women are aware, they're able to participate in the economy. They're able to go to work. They're able to be productive. They're able to study further. They're able to, you know, participate in decision making. So if they're not well, they will take little care of themselves and they'll worry about the people around them. They will not be able to participate in bigger projects such as decisions of economy. So and they are able to even overcome, if the woman is well, they're even able to overcome conditions that are specific to women. Like, for example, it's only women who suffer from premenstrual syndrome. Premenstrual, when the period's about to come, you are really sick, moody, tired, sometimes even in pain. So if you are well, if you are healthy, you're able to overcome those things. There are other women's health issue matters or gynecological matters such as menopause, such as pregnancy. You're able to navigate them safely. If you're well, if you're taking care of yourself, you're even able to have safe pregnancies. Fertility is able to be preserved, because if you're not taking care of yourself, sometimes you even struggle to fall pregnant, and sometimes you fall pregnant and unable to keep the pregnancy because you are not healthy, you are not well. So that's the importance of a mother's health. So it starts from even trying to conceive, goes way up to even trying to make decisions for our economy, for our society, for our country. So it's very, very important for the mother to be well, because they tend to have an impact on the next person.
You know what you're saying, Doctor, it confirms to us that as mothers, I think we are just some special species. God has given us something that even ourselves we cannot even comprehend. That's why I said I liken a mother to a fig tree, because you're talking about um, being healthy, enabling you to be able to give birth to healthy children, enabling you to give birth, to keep that pregnancy, women having to go through menstruations and a whole lot of other things. You can see how much a mother has been entrusted with. So this afternoon, as we zooming in into looking at the mother's health, because we felt as Prudent Woman, as we celebrate mothers, let us also caution each other on all or a number of these issues that as a mother we must look out to. And we understand that the 1 hour may not be enough, but we will have done something. So, Doctor, I wish for us to look at least maybe at 3 health issues, zoom into them, just to highlight. At least it will have given us a format on how we can go and look at the different health issues that may be out there or that may be of concern, because I would like to believe each one of us at a given time, you find that there's something that you're concerned about. But with your guidance, one will be able to say, how do I navigate this? How do I now check through this and understand why certain things are this way? So I would like us to, you touched on it briefly, to look at menstruation. I do not want us to take it for granted that we all understand why we have to go through menstruation. And having you here with us this afternoon, I think it's an opportunity for us to start there, even before we go into the other complications that I know in one way or another, almost all mothers who have been affected. If you have not had the undergone through such a challenge, but you have someone closer to you who has gone through them. But why do we have to go through menstruation as women?
Okay. Ma'am Rhulani, do you remember in the Bible when Eve ate the forbidden fruit and they were chased out of Eden, and God said to Eve, "You will bear children. You will bear children, and it will be painful." So menstruation or menstrual cycle, let's say menstrual cycle, is just the body trying, saying, we failed to get you pregnant. So from the age of like 12, at least God was lenient. Imagine if a 7-year-old was to fall pregnant and now have to be fruitful and multiply. It was going to be even more traumatic and painful. So God was lenient and said, we'll start preparing your body for this pregnancy thing around the age of 12. And then they start having menstrual cycle. So every month, so a woman is born with all the eggs or the follicles, all the eggs that they're gonna need to fall pregnant in their whole lifetime. And they are usually around 500,000 to even some, they go close to 1 million of eggs. So every month, the brain sends a message to the egg to say, please take out around 20 eggs. Let's try to get this woman pregnant. So the eggs will grow, they will grow depending on your cycle. Those who have a 28-day cycle, it may take 14 days for the egg to fully grow. So as they grow, they are competing with food and all that. So there'll be one that grows bigger than all of them. And then it will pop out of the egg and goes to the tube and wait for the sperm. It only waits for the sperm for 24 hours. As you know, women generally not patient. Even our ovaries are not that patient. So we wait for the sperm for just 24 hours. Then if no sperm comes, that egg dies. So mind you, when the brain sends a message to the egg to say, grow about 20 so that you can fall pregnant, it also tells the womb to say, prepare yourself, thicken, grow, nourish, so that if the pregnancy happens, it's gonna implant or it's gonna stay in the womb, inside the womb. So where it's going to stay, it needs to have blood vessels, it needs to have, blood supply ready so that the pregnancy can grow. So now what happens is if the sperm does not come while waiting for, while the egg is waiting in the tube, what happens, that egg dies, then the message is sent to the brain to say, that man we waited for 24 hours. Hi, since Saraswara did not come. So please unpack the inside of the womb so that, because there's no man coming. So the message is sent to the womb to say, I break down. So when that layer inside the womb breaks down, you see blood. That blood is what we call menstruation. And it may take about 14 days for that layer inside the womb to break down. So that is what we call menstruation when you see that blood. So by the end of that 28 days, you'll have bled out all the blood. And then next month, the body sends the message again to the ovary. Let's start afresh. Maybe this eggs will give us a baby. They start afresh. Every month, the body is trying to get us pregnant from the age of 12 up until you reach menopause, which is average age around 45. Imagine every month. God was serious about this business of making us be fruitful and multiply.
We had to be fruitful and multiply. And you know, as you explain it, it makes one to understand, because majority of us, I don't know any woman who has ever said they appreciate the cycle. We all do not want it to happen. When that time comes where you see the blood, we don't want it. But once you understand what is actually happening, it gives some level of comfort to say, if it's not happening, then it means I will not be complete. This completes who I am as a woman, a man with a woman. So thank you, doctor. But we
Actually,
normally
yes,
hear,
for a second.
yes, you can come in.
Okay, sorry about that. I was saying, so it's actually the most reliable pregnancy test. Seeing that blood, then
Okay.
you know it did not happen. So that's the menstrual cycle. So for those who are trying not to fall pregnant, wait for those periods. When they've come, whew, it did not happen. Then you look for the next one.
I can just imagine our grandmothers back then without all these tests that we have now. That's what they used to use. And it was reliable. It cannot lie to you.
Yeah.
Yeah. We tend to hear that there is what they will say it's an irregular menstrual cycle. What is it that you'll consider as an irregular cycle?
Okay. So women are different. We're all different. There are some that have 26-day cycle. Some have, it can go up to 35 days. Some take 35 days. And the reason why we have variations or differences in the menstrual cycles is the time that it takes for those eggs that I was talking about to grow. Some the eggs grow so quickly, then they're able to have ovulation faster and then have their menstrual cycle. Some they take a bit of time to grow, so that's why some people have 35-day cycle. So the important thing is to always record your cycle using a calendar. You can use a phone to say, this is the day that I had my periods, this was the first day, this was the second day, this was the day. Because in order for you to say this is an irregular pattern is when you analyze the periods over a period of time, the menstrual cycle over a period of time. You see, this month it came after 26 days. Other month it came after 35 days. This month is coming after 28 days. Then there you can tell you it's irregular. It's supposed to get, because they say no. People when they come to consult, they say no, it came on the 28th. And then, yeah, the following month it came on the 1st. But when you sit down and analyze those dates, you realize no, it was regular. It was coming after every 28 days, just that the 28th day fell on a different calendar day as compared to the other. So that's why I say, in order for you to tell that this is irregular or whatnot, is to record the dates each month when the menstruation come, and then you can see that this is coming after how many days. Some it's obviously irregular, like some people have menstruation after every 2 weeks. It's too short for a cycle, because a cycle can be 26 to up to 35 days. So if they're having a menstrual cycle after like every 2 weeks, that tells you that it's irregular. Also, having prolonged, you're supposed to have periods for like 3 to 7 days, and that's when you're supposed to menstruate. But some menstruate for like whole 2 weeks, or menstruate 8 days or more. That is long. That is too prolonged.
So, thank you very much, Doc. We are talking on the mother's health, and this is Prudent Woman. All of you who have just joined us, you are welcome to be part of this conversation. Doctor, there's a question that's coming through, someone saying, besides the irregular and regular cycles, one thing that they do not like, it's the issue of pain. Why do we have to have the pain? And how can one make sure that they ease the burden of this pain?
Okay. So the reason why people can have pains, first of all, when the message is sent from the brain to the layer inside the womb to say, no man came, breakdown. So what happens is that certain chemicals in the body called prostaglandins are recruited to be the ones breaking down. So can you imagine something that breaks down? It can be painful. Remember when you destroying a wall, you bang it, you do all sorts, and that can be really painful. So that's why some people have period pains. But sometimes the period pains are due to other abnormalities. Like people have period pains because they have things like endometriosis, they have things like cysts, they have adhesions, they may have hydrosalpinx, the tubes are blocked. Those are the things that can end up making someone have period pains. But you don't have to suffer from period pains. There are painkillers that are very good for period pains. The important thing is that do not wait till the period pains are too intense to start taking the painkillers. If you know your cycle very well, and you know that tomorrow, according to my calendar, I'm going to start period pains, before even the pain comes, you start taking your painkillers, you will be able to go through the menstrual cycle, start feeling so much pain. Sometimes it has to do with the nerves and on our spine. So services like chiropractor, there are doctors called chiropractors. If you go to them, they align your spine again, and then you don't get the period pains. So those are the things that I've found to be really helpful when it comes to period pains. Taking the pain medication in time, also making sure that whatever other conditions that you have that can make period pains be there, like ovarian cyst, endometriosis, are treated. And then the third thing is, if you cannot bear the pain, you're not able to take painkillers all the time, then you can go to a chiropractor. They align your spine, and then you are less likely to have these period pains.
One thing that I believe we should all appreciate is the advancement within the science fraternity, the medical science fraternity, because you'll agree with me, all of you are listening to this conversation, to say, whenever you talk to a doctor, medical specialists, let me say, if you talk to them today, 2 years down the line, you find that there's a new thing that is out there. Like you're talking about lining the spinal cord to take away the pain. I do not believe it was there 10 years ago. So you can never say you have learned enough. And we appreciate the work that you are doing, Doctor, together with your colleagues, because you time and again continue to do research, continue to come up with ways on how you can improve the quality of life by providing all these alternative medicines, procedures that helps to bear the pains that as a human being we go through. So we so much appreciate it. And you'll agree with me, the topic on menstrual cycles, we will never exhaust it, but I will want us to move on further down. Let's talk on infections. I have realized that quite a number of us as women, we tend to have one infection after another. I do not know it's because of our makeup or why, but we tend to have such infections. And some of them, when you go to the doctor, they'll say, no, it's not, you don't have to be worried. You have to do this. But every time, as they explain, you realize that there are things that you can do to make sure that you prevent yourself from these infections. And that's why we felt it's important for us to also zoom into this issue in this day as we talk about mother's health on infections. Dr. Chiho, what will you like to say around the most important or the ones that you wish to highlight to mothers, infections that you like to highlight to mothers linked to gynecological issues? But before we do that, I will want us to pause. Let us take an ad break, but when we come back, Doc, I will want us to look at that.
Ladies and gentlemen, here it is.
Streaming 24/7.
24/7.
Bold Moves Radio.
Bold Moves Radio.
Afrika nakupenda sana, oh Afrika nakupenda sana.
You are listening to Bold Moves Radio. The show is Prudent Woman with myself. I am Rhulani Baloyi. This afternoon, we have the conversation on a mother's health with our doctor, Dr. Chehu. She's our gynecologist. Doc, before we went on a net break, we looked at the menstrual cycle and we are now zooming into the infections. What will you like to highlight to us around infections? Which type of infections and what is it that we can do to make sure that we guard against ourselves having such infections?
All right. So firstly, before I go into infections, I want to talk about discharges. So as women, we have normal discharges. The color, the consistency differ, with which portion of the menstrual cycle are you at. So usually when you are around ovulation, it will be like egg white. It's clear, the egg white. Then towards after ovulation, then you have just a whitish creamy. It's like yogurt, like plain yogurt type of discharge. It does not smell. The vagina has a distinct smell. It doesn't smell like fish and doesn't smell like strawberries either. Because sometimes women, want it to smell like strawberries. So come and say, but I'm smelling, but you look, it's not an offensive smell. We all know a bad smell, It has a distinct smell. It needs to smell like a vagina. Those discharges are normal. Then you have infections. The common infections that we see in women is the urinary tract infections, and we have vaginal infections. The urinary tract infections, if the way we are made up as women, the vagina and where number two comes out and when the urine comes out, they are very close to each other as compared to women. So sometimes infections from the area of number two or the anus, they come to the vagina easily because it's so close, and then they can cause infections there. And then also they can come from the urine side and cause infections in the vagina. Then you get discharges that are foul smelling. um, I've heard people say toilet seats, can give urine infections. Um, the science does not add up, when you check how it gives you, but it can give you things like herpes, like you can have sores around your vagina or your bum if you've set on infection like herpes. But the urine infection usually has to do with how you wipe, usually has to do with whether you're drinking enough water. If you don't drink water, then there's a lot of acid. It can harbor infections there and you end up getting urinary tract infections. When it comes to vaginal infections, firstly, it can be due to, like I said, infection from the anus can go into the vagina and cause changes there, cause discharge. Secondly, can be most of the time is sexually transmitted infections. So those sexually transmitted infections will give you discharges that smell bad. They smell like fish. Um, yeah, they don't smell well. The color, it can be yellow, and then sometimes you can have greenish discharge. You can have discharge that looks like what do you call this thing? Sour milk in Gomasi. Uh, yes, you can have that. Um, Usually that is because of the pH, the environment in the vagina has changed. Like I said, sometimes we want the vagina to smell like strawberries, so we use soaps, we use foam baths, and then they change the area in the vagina. And in the vagina, there are some bacteria that stay there. They're supposed to stay there, it's their place. And then when you come, maybe you bathing, you put fingers inside or you're using soap, then the bacteria, because it's their home, then they start getting frustrated and angry. They release acids and all that end up giving you itchiness, that end up giving you this thick discharge, thick cottage cheese like discharge because they are upset. This is their place. Like right now, Mom Roland, if I come into the studio and I start taking those beautiful flowers next to you and whatnot, what are you gonna do? You're gonna fight back. So even the infections start fighting back when you get in. You're putting your fingers, you're putting your foam bath because they are disturbing their place. So that's what happens. So I always say to women, when you bath, the vagina knows how to wash itself. Don't put fingers inside. Just wash outside with pure water. You don't need soap there. Trust me, if you do that, you will not have issues of this recurrent discharges. So if you already have discharge, let them get treated. Once they are treated, then you start just washing with just pure water, nothing else.
Mm-hmm.
Okay.
You know, when you talk about that, it's one area that as women, because, and you cannot blame us, we want the best for for ourselves at times,
Yeah.
especially when it comes to cleanliness. And
Yeah.
unfortunately, you go to the commercial side, they've got quite a lot of products that they're selling and saying it will make it smell like strawberries, as you have said. And unfortunately, we get tempted by those things and use them. But over time, as we continue to listen to medical scientists telling us that there is no need, and you have put it correctly to say you fighting the bacterias by bringing in foreign objects, and they fight back by giving you those type of discharges. But the question that I will ask is, should it happens, to quite a number of us. When it happens, when should I be concerned to say, now I think I need to see a doctor?
So when you start being smelly, when you start being the consistency that I talked about, I said the normal ones is like egg white, and
Mm,
then you have creamy like yogurt. So if you have any other color, any other consistency than the two I mentioned, you
Mm.
can consult. And some of them, you take them lightly. You say, "Hey, smells nyana, what not?" You don't go consult. You go to the pharmacy, buy over the counter, and then it doesn't completely treat. Because sometimes we're able to tell that this one need multiple type of antibiotics, and then you don't treat it. Over time, it damages the tubes. Later on, you want children, they're not, you're not falling pregnant because the tubes have been damaged by this, because they move up. They don't just stay in the vagina. When the bacteria come, they go up, they move up the uterus, go into the tubes and damage them, and then you end up having issues falling pregnant. When you are not sure, come, we'll educate you and say, no, this one that you're having is normal. So from now on, you'll know, if I'm getting this type of discharge, it is normal, it's not an infection. The thing I like about urine infection is so painful, it's so destructive. So that one I won't tell you when to come, because they will
You'll
come.
just
They
come.
just come. It makes you go to the loo every 2 minutes, and then you just go only, urinate 5 meals. But you feel like you are pressed. It's painful for the urine to come out. They just come. You don't have to even advise. The one that is tricky is the discharge, the vaginal discharge, because sometimes it's not painful. Some is
Mm.
painful. Sometimes it's not painful. It just gives you this smell. It swells your underwear. I know some people even get concerned that no, the discharge changes the. It's like my underwear is bent. It's because of the pH of the vagina is acidic. So
Mm.
the acid, that's why sometimes it discolors the underwear. Sometimes, most of the time, is a normal
Mm.
discharge that discolors because it's acidic.
Mm. Mm.
Yeah.
Wow. If you have just joined us, we are having Dr. Chiho. She's a gynecologist. We are talking on mother's health. And those of you who are part of this conversation, thank you very much for being part, because together we become prudent women. Dr. Chiho, as I indicated, our time will never be enough. But before we can even let you go, I wish for us to talk on family planning. Because you spoke about women having to make sure that they are healthy, to be able to keep the pregnancy, to be able to give birth to healthy children. But today, you look at how life is. It's unlike back then, when women were back home, didn't have to go to work, and we could give birth because we were actually plowing and producing our own food. But in today's world, we all have to go work somewhere. It's more challenging to take care of many children. So we have somehow adopted this culture of planning our families, and we use family planning contraceptives. But recently, I've listened to quite a number of talks around contraceptives. And my apologies, for the better
Sorry.
part, um, we had, we were given these contraceptives without much explanations. It was like, it's the best thing that could ever happen. And we were not taught about their side effects and all this and that. And recently, I had quite a number of discussions around the side effects of family planning. So I thought, let's just highlight them. And prudent women will go and research further on the types that they're utilizing. But what will you like to say around family planning and their side effects? And how can I go about choosing that which is good for me? Is it important that I go make a consultation? They look at my medical history to be able to say, this one may likely be the best thing for you.
Okay. So when it comes to family planning and fertility, so the ideal time for one to fall pregnant is in their late 20s. So around age 24, 25 is a good age because their fertility is usually still good. The older you are, the harder it becomes to fall pregnant. And that age, they have less side effects. So round up until the age of 35 is a good age, between, let's say, 24, 25 to about 35 is a good time to fall pregnant. Now the problem is people are getting into relationships before that age, or maybe even that age, they are within that age but they are not ready. They're not ready to have kids for many reasons, economic reasons. They're still studying. The women these days, we're trying to be involved in the economy, decision making, and we decide to postpone our fertility and say, no, I'll fall pregnant later. So that's how people go on contraceptives. The other thing is good to space your children for economic reasons. Imagine you have 3 kids in varsity at the same time because you're giving birth this year, the following year, other year. I know the gogos will say, no, no, dear, ufetse. But later on, then it backfires. You are struggling. You can't even buy yourself a cell phone because now all kids are in university. They need your money. So that's what happens. So there are many contraceptives, and it all depends on your needs. What do you really want? Some, they just want to not fall pregnant this month, but next month they are ready. So you can give them contraceptives that last them a month. There are some that say no, I want to fall pregnant in the next 3 years. There are contraceptives that you can put today and they'll last that long. There are some that can last you up to 5 years. So you say, no, I want my kids every 5 years. And then there are some that say, I forget my pills, but I don't want something that lasts for more than a year. Then you have things like patches. And there's a more common side effect is, they differ from person to person. Some, they make them gain weight, some they don't, they're just fine. And you can have nausea, you can have abnormal periods. You can have periods just coming haphazardly. And then some, they actually make you not to have periods at all. And then you have people come and say, this thing that I've inserted is making me not to go on periods, please remove it. Remember the process that I explained, Ma'am Rhulani, of the menstrual cycle. I said when the body is preparing, is telling the eggs to grow so that they can come and meet the sperm. It tells them inside of the layer to prepare itself for pregnancy. So if you're on contraceptives, usually most contraceptives tell the brain to say, hey, don't send a message to the eggs to grow. We don't want the eggs to grow because we don't want to fall pregnant. So sometimes the brain also sends a message to the womb to say, hey, we are not going to grow anything there. We are not going to prepare any layer there because we're not going to have pregnancies. And then that's how people don't have menstruation. So those are um, the side effects of contraceptives.
But then, will you advise us as mothers, as women, to go to a doctor, do a consultation before you take a contraceptive? Or it's not that important for one to do such consultation, but you can just go with whatever that is recommended by your friends?
Yeah, that's what sometimes happens. They say, but Anis, we used to find it was, or when women come for the first time, say, doctor, can you write me prescription for 1, 2, 3? I always ask, have you used it before? They'll say, no, I have not used it before. So how did you come to the decision that this is the one for you? Say, no, my sister used it and it's fine. So I always advise, go to the doctor and say, I want contraceptives. I don't want to fall pregnant in the next 2 years. Give them your history, they take your history, they do your examination, and then you decide together with the doctor. The doctor will not decide for you. You decide together with the doctor. They will give you the options that are available depending on how you live. Some say, hey, I'll forget this pill. So even if as the doctor you think pills is the one for that person, you cannot decide on the pills because they will forget them and then they'll fall pregnant. So go to the doctor, let them give you the options that are available, and then you can choose together which one will be ideal for you. Some will end up having to be trial and error, and some you have to go on them. And then when you experience the side effects and you're not able to handle them, then you have to change to someone else. But consulting beforehand decreases the chances of having those side effects.
Wow, thank you so much, Doctor. We've looked at a number of health issues that concerns to mothers, and I'm asking myself, when you look at what we have gone through this afternoon, are they somehow related to the age, or it can affect all of us the same, or certain age group is more at risk of undergoing certain things, or is it the same, or does it go with age?
So, yeah, age does matter, especially when it comes to women. So there are conditions that we commonly see in adolescents. We commonly see irregular menses and period pains in that age group. Sometimes you can have not so common, like things like delayed menstruation or menstruation that comes too early. So that group, you're likely to see that. Then you get to the reproductive age, that age where people are falling pregnant. Then you start having issues related to pregnancy, like miscarriages, ectopics. They can also still have irregular menses, but most of the time they're secondary to something. You find that this due to fibroids, is due to cysts, So those are common things that we find in the reproductive age. And then even in menopause, which is after the age of 40, then we can start having irregular menses again. Most likely because menstruation is like driving, is like a car. So when you remember when you started driving a car, it will stop, it will switch off when you don't want it to switch off, sudden brake and all that, because you're trying to learn how to drive a car. So that is when it comes to menstrual cycle terms, it would be like your adolescent age. So when you're in adolescence, your body is trying to drive this menstrual cycle story. So that's why sometimes it becomes irregular. You even have pain because the body is adjusting. Then you go to your reproductive age. Now you are the driver, just like in normal life when you are now have gained confidence, you even bully the taxi drivers on the way. So when you're in reproductive age, you are able to, your body is able to navigate this menstrual cycle well, unless if there are stumbling blocks like the ovarian cyst and the what do you call this, fibroids. Then menopause is like now the car is getting old. So the menstrual cycle, the eggs have been through the most. Remember, you've had them since birth. So they've been alive, they've been exposed to smoke, they've been exposed to all sorts of toxins in the body, and then they are tired. So they are not performing well. Then you end up having irregular menses. So menstruation is like that, it's like when you're driving a car, when you're starting off, it's like in your adolescence. In your menopause, the car now is getting old. Parts are getting worn out. That's why eventually at some point the menstruation even stops. You don't have it at all. Because now what happened? The parts have worn out. Koloi is stakile, iemile, so that's what happens. So yeah, that's menstrual cycle. So it is, some of the gynae conditions are more age dependent. We see more cancers in the older women than in the younger.
Yeah. I love your illustrations. They make one to understand better, what is happening in a person's body. As you say, in terms of age, they may be different at different age groups. As women, we tend to think, maybe let's use menstrual cycle. If I have got menstrual pains, my daughter is likely to have one. How true is this? Are they hereditary, or is that by coincidence?
Some conditions are hereditary, so it can be passed down. the family, but not all of them. So there are certain things that, yeah, like things that can be hereditary. Like sometimes if you menopause early, your kids can have menopause early as well. Those kind of things. Yeah. So some of the conditions can be hereditary, but not all. Sometimes it's also the biggest influencer or the biggest influence is lifestyle. You know, how you eat, how you exercise, how you take care of your body plays a big role.
Okay. Yes, Doc. Unfortunately, our 1 hour it's almost coming to an end. As we always say in Prudent Woman, an hour is not enough to have a conversation that will empower us with all the information. But we say we spark conversations. And I would like to believe this afternoon we have sparked conversations. Let's have conversations with our daughters, have conversations amongst ourselves as mothers, and help each other. Because, Doc, there's one thing that all of you medical scientists always say: prevention is better than cure. And that's what we're hoping to do this afternoon, to say, let's talk on these things. Let us not wait until when it's too late and you need to go and see a doctor to be able to get medicine to help you go or cope, because some of the conditions cannot be treated, but they just give you something to cope with. Let us prevent all these things, and we can prevent them by getting information on how to live and take care of ourselves so that we can be in a healthy state. And we appreciate people like yourselves, Doc, who come through and educate us on all these issues. Before you bid our listeners farewell, I would like to invite you. This is a Mother's Month, May. What
Okay.
will you like to talk to us? Things that I never got to ask you, or no question that came through asked you about, which at this point in time, when we look at the health of a mother, is very important, and you think you cannot leave this conversation without talking about it.
Okay. Health in a mother, it's simple things like, when you are overwhelmed, you take time off, you take care of yourself. It's okay to go have coffee alone. No baby, no husband, no coco, no what, just you by yourself. Appreciate yourself. I know you're worried, this money I could have been by this is for my kids. It's important to take care of yourself as well. When you're mentally well, your mental health. I know we tend to not speak a lot about issues that bothers us. We just bottle them up and then we keep our head high like nothing happens. When they pile up, before you know it, you're passing them on to your children, and then you develop kids with personality disorders that become problem in the society. Also prioritize your health. You find that you as a mother, you are in and out taking kids, husband, wherever, to the doctor, but you never go and say, let me check if I have any conditions. Let me go for just a full gynae checkup or comprehensive checkup to see if I have any conditions. Because when you are sick, if you get sick as a mother, just imagine what happens to the family, what happens to the community. Now, what happens to the society if you are not well? So take care of yourself. Go for a regular health check. Check your blood pressures, your sugars, your cholesterol. Eat well, exercise, sleep enough, and then that way you remain healthy.
Thank you very much, Doc. We appreciate the time that we have spent with you. And of course, some of our listeners and our viewers who have been part of this conversation may like to get in contact with you to do a consultation or get more information on some of these things that we're talking about. As you bid us farewell, kindly share with us how can they get hold of you and your services.
Okay. Like I said, I have a private practice. The branches, so far, we are in Mokopane. We have a branch in Mokopong, Modimolle, and Lepalale. Polokwane, we are coming soon. Just watch the space. We'll be coming there soon to give you our services. But if you need our service, you can visit one of the branches I've mentioned. Just contact, call, or WhatsApp 071 200 3933. 071 200 3933. You can make your inquiry, you can make your appointment, and then we'll be able to assist you.
Thank you very much, Doc. And thank you to all our listeners and our viewers. This was Prudent Woman on Bold Moves Radio. We'd like to say thank you to our technical team, our executive producer, Pastor Strike Mangani. We'd like to say thank you. And this afternoon, we had our young man, Sean. DJ Sean was with us here on studio. Thank you very much for the time that you have spent with us. All of you who have just joined and you did not catch the whole conversation, we invite you, go and listen. We were talking on mother's health and we had Dr. Tshegofatso Sekhaolelo. She was here with us, our gynecologist, talking on mother's health. And of course, we could not exhaust all the health issues that affects women, but we could only look at the three. And we're saying we've sparked the conversation. Have conversations with yourselves, have conversations with our daughters so that we can live a healthy life, to be able to give good quality of life to our loved ones and those around us. Have a blessed month ahead, even as we continue to celebrate the month in which we are saying thank you to all our mothers. Happy Mother's Month. Have a blessed afternoon. Thank you.